Imagine feeling like you're not in control of your life, that despite all of your efforts, you often find yourself struggling and feeling frustrated by your inability to manage everyday tasks. Until recently, this had been my experience. Then I learned I had ADHD, and a lot of my struggles made sense. I was fortunate that a loved one was able to identify the symptoms, and I was able to seek help and start a treatment plan to help me cope with my ADHD. Unfortunately, the same cannot be said for many other adults who are unaware of their ADHD and continue to struggle daily, which leads me to the topic of my presentation: undiagnosed adult ADHD. ADHD is a neurological disorder that affects executive function, the system in our brain that helps us with problem solving, organization, time management, and emotional regulation. ADHD is a fully treatable condition, yet this topic remains relevant due to the amount of adults who continue to struggle day by day because of the lack of diagnosis needed to treat ADHD. The National Library of Medicine website last accessed on July 18, 2022 states, fewer than 20% of adults with ADHD are currently diagnosed and or treated by a psychiatrist. It is my goal today to encourage anyone who suspects they may have ADHD to seek information and seek a diagnosis. In this presentation, we will examine how the lives of many adults with undiagnosed ADHD are affected, some of the causes for the lack of diagnosis, and consider some solutions to increase the number of diagnosed adults with ADHD. When ADHD is treated, people can live successful lives, but when left untreated, many often find themselves struggling in school, at work, and in their personal and social lives. A January article on attitude inside the ADHD Mind website by Dr. Edward Hollowell states, adults with undiagnosed ADHD get fired from their job more frequently, impulsively quit, underachieve, slowly losing self-esteem, confidence, drive, and joy in life. Because of their struggles, many adults with undiagnosed ADHD are at higher risk for developing mental health disorders such as depression, anxiety, substance abuse, and other compulsive bad habits. Now that we've discussed how the lives of many adults with undiagnosed ADHD are affected, next, let's examine some of the reasons behind the lack of diagnosis. Many adults with ADHD are unaware of their ADHD. The website CHAD, last access on July 26, 2022, states, many people with ADHD go a long time without being diagnosed. Sometimes they never get diagnosed. Commonly, this is because they simply don't know the symptoms of ADHD, and no one else recognizes that they have signs of ADHD either. So they live in a not so blissful ignorance. In addition to many being unaware of their ADHD, many medical and mental health care professionals are also not trained to recognize symptoms of ADHD in adults, and often only recognize other mental health disorders that develop because of ADHD, leaving many adults untreated for ADHD for additional months or years. After exploring some of the causes, there are a couple of possible solutions to consider to help increase the number of diagnosed adults with ADHD. Education can be an effective way to increase the number of diagnosed adults with ADHD. There are many online resources available, such as Attitude Inside the ADHD Mind, CHAD, ADD.org, and the National Institute of Mental Health, that have a vast information on ADHD, its symptoms, and many also provide a safe place for people to come together as a community to support each other. Many adults with ADHD have a hard time expressing what and how they are feeling, but by learning more about ADHD symptoms, they can better communicate with their healthcare providers and help them come to an ADHD diagnosis sooner. The National Institute of Mental Health website, accessed on July 21st, 2022, states, if you're going to your primary healthcare provider for other health concerns, remember to bring up your mental health concerns. This is important because healthcare providers are not mind readers, and they can't treat for what they are unaware of and what they were not trained to identify. So, communicating with them about your mental health and other symptoms you may be feeling due to your ADHD is another effective way to increase the number of diagnosed adults with ADHD. Additionally, the more adults that seek help for ADHD, the more medical and mental health care professionals will learn how to identify ADHD symptoms and be able to help more people in the future. Today, we have discussed how the lives of many adults with undiagnosed ADHD are affected, explore some of the reasons behind the lack of diagnosis, and considered some solutions to increase the number of diagnosed adults with ADHD. If nothing is done, many adults with ADHD will continue to struggle financially, socially, emotionally, and mentally. But by seeking information about ADHD, more people can become aware of the symptoms and can better communicate with their healthcare providers to help them come to an ADHD diagnosis sooner. Seeking help can be difficult, but ADHD is a fully treatable condition, and a diagnosis can make the difference from feeling like you're not in control of your life to taking control and living a successful life.